Start your timer.
Hello and welcome to The Art of Being Human. Today I'm going to go into alcoholism. Next segment will be alcoholism, and then we're going to kind of finish up with a segment that I'm doing on drugs and get into something else. However, I do want to talk about a new drug first before I get into alcoholism, and that's a new drug that's called W18. It's a new synthetic drug, and it's an opioid. Now, the opioids are the hard drugs like cocaine, morphine, opium, and drugs like that, heroin. Those are the opioids. And this is a new opioid drug. It's synthetic, which means basically it was made in a laboratory, and it's so new that it doesn't have a name yet. It's been labeled W18, but it is on the streets. And somebody made it, and it is 1,000 times stronger than morphine or fentanyl. If you can imagine, I've talked about morphine, I've talked about the various hard drugs, and I've talked about fentanyl as being more difficult than even those other drugs that I've mentioned. And this happens to be 1,000 times stronger than fentanyl. What happens is if you take one dose, you die. I mean, it's so strong that there are any numbers of people who take just one pill. They've showed it on television. It's a round pill, and it looks to me like a darkish green color and a fairly large pill. You take one dose, and it's so strong that you can die from it. And we're losing about 4 or so people a day to this drug. You know, when the advertisers come on, or it was a politician, I guess, who said we're going to lose an entire generation to drugs if we don't do something. And at first I said, well, yeah, maybe. I didn't think that it would be that bad. But when you get the synthetic drugs that are made in labs by people who just want to push the drugs for the sake of their profit, well, then you can get a lot of people dying from drugs, a lot of young people dying from drugs. So what I want to do is to, as I go along, I'm doing alcoholism, but as I go along in my shows, when I pick up information on a newer drug, I want to bring it to your attention, so I might possibly kind of come back and revisit the drug scene every so often just to keep you up to date with what's going on. It's kind of hard to keep up to date on your own. You need to have somebody kind of do it for you because there's just so much information out there, and there are just so many new drugs out there, and they can be really bad drugs, and they can really hurt and kill people. So that's the latest, W18. Now, I'm going to go into alcoholism. Alcohol is interesting because it is kind of the drug of choice for many, many people. It is a natural substance, and it's due to the reaction or fermentation of sugar and yeast. Now, the alcohol that people drink is called ethyl alcohol, and it's abbreviated ETOH. And it is a food. Alcohol is considered to be a food, but it doesn't require digestion, and it has no nutritional value. The reason that it is a food is that it does have calories, and if it has calories, it's considered to be a food. Now, there are different alcoholic drinks due to different sources of sugar. It's fermentation of sugar and whatever it's fermented with. But there are different types of sugar. Beer comes from malted barley. Wine comes from grapes. Rum comes from molasses, and whiskey comes from malted grains. Different sources, but it's all fermentation. These are the different types of alcohol drinks that exist. Now, alcohol depresses the central nervous system. Now, the central nervous system consists of the brain, the spinal cord, and the major nerves that come from the spinal cord. And it causes behavior changes and mood changes. Now, the autonomic nervous system would be the nerves that control, like your digestion, the movement of your body, chemical processes that are in your body. But the brain and spinal column are considered to be the central nervous system, also abbreviated the CNS. So it causes behavior and mood changes. And the effects of the alcohol that you're drinking depends upon how much you drink. The more you drink, the more profound the effects. And that's also true of marijuana, because I talked about marijuana and the different problems that exist with it. So the marijuana and other drugs, what you get for results of that, what you get for symptoms of use and withdrawal symptoms, depends upon how much you have taken to begin with. Now, intoxication occurs from 0.08 to 0.10% in your bloodstream, and the body burns alcohol at 0.5 ounces an hour. So you consider how fast, how fast that you burn the alcohol, and anything above that will cause you to be legally drunk. Now, the effects, as I said before, depends upon how much you've taken, but it also depends upon how, if you have eaten, that slows down the process. Your size and your weight makes a difference as to how you react to alcohol, or if you are tired or if you are stressed. So there are different variable factors here if you're drinking. So half of Americans 12 years old drink alcohol. So you're talking about 50% of 12 years old and up. 12 years old seem a little, or it did seem to me as being pretty young to start drinking alcohol, but you stop to consider some kids are using drugs as early as 5 and 6 years old. As a matter of fact, some children attempt suicide at 5 or 6 years old. Now, a child does not have the brain development to understand the permanence of death. Even people who are, preteen, junior hires, they don't understand or they can't really comprehend the seriousness of suicide in terms of death as eternal, death as permanent. They have a hard time conceptualizing that. It's not because they're not smart enough. It's because the brain has not developed to the point where they can appreciate that. I remember when my father died, and they were young children, my nieces and nephews. They were in school, but they were young. Some of 5, 6, 7, and 8 years old, around that age. And they thought that if they sent a balloon to heaven, that they could bring my father back down. It never dawned on them that it couldn't be done. And it never dawned on them that when a person dies, they're gone forever. You do not see them on this earth again. But they don't understand that, and they don't have the brain development to understand that. So when you consider half of Americans drink at age 12, and really for many of them even younger than that, but the statistics I have is 12 years old, then you have a very serious problem. Many people drink just to relax, to celebrate life, for special occasions. Alcohol is in many other substances. It's in cough syrups. It's in many medications. It's in many over-the-counter substances that we buy every day. We don't even think about it, but a lot of it contains alcohol. And alcohol is the third leading cause of preventable deaths in the United States. Now, the nation's #1 health problem is alcoholism. It strains the healthcare system. It puts a strain on the economy. It harms families. It threatens public safety. It causes 1/4 of all emergency room admissions, and it causes 1/3 of all suicides. When you study suicides, and I've done special seminars, I'm kind of a suicide specialist, if you think about it, that most of the people are going to be drunk in order to consider suicide. There's just a whole formula that I have, which I'm not going to discuss now, but to predict who's going to try to commit suicide and who is not. But it causes 1/3 of all suicides. And 1/2 of all homicides and domestic violence is due to alcohol. It's alcohol related, and it contributes to heart disease, cancer, and stroke. You know, you don't stop to think about it. When I go to the doctor, and of course I have cardiac problems, the thing that they always ask me, even though they know what the answer is going to be because I see them time and time again, do you smoke? And of course I don't. I've never had a cigarette in my life. I've never smoked, and I've never drank an alcoholic drink either. I just stay away from it completely. But the thing is, they always ask because it's so damaging. They ask about the smoking first, and I think it's because smoking damages blood vessels. And if you've got a heart problem, and if you're already compromised, what you really don't need is more problems with your blood vessels. And if you're diabetic too, because your blood vessels are really damaged by the diabetes, so are your nerves. So it contributes to heart trouble, disease, cancer, stroke, and you do have such a thing as fetal alcohol syndrome. Fetal alcohol syndrome is when babies are born addicted. If you are taking drugs, or if you are drinking and you're drinking alcohol, where does it go? It goes right through the umbilical cord, right into the baby's, the place where the baby is growing. And the baby gets it in his blood. You have the umbilical cord connects the baby with its mother's blood supply. It's the mother's blood supply that is nourishing the baby while it's in the uterus. So if the mother's drinking, the baby's drinking for all practical purposes. And so this is really serious. If you've seen a baby that's addicted to alcohol or drugs, it's a pitiful thing to see because they're shaking, they can't stop, they're screaming, they're in pain. It's just a miserable way to be born because they have suddenly no alcohol going into their system and no drugs going into their system because after they're born, they're separated from the placenta, they're separated from the umbilical cord. They have no source of that supply of drugs and alcohol that they had while the mother was carrying them. Most women, if they do have a tendency to drink, even socially, will stop drinking when they're pregnant because they don't want that stuff going into their baby. You have to remember that with alcohol, it doesn't require digestion. And when you drink alcohol, 20% of it goes into the blood system straight from the stomach wall. It goes into the stomach and just goes right through the stomach wall, right into the blood supply. No digestion. So you have 20%, whatever the body can tolerate, 20% of what you've drank, in the bloodstream circulating around, and the rest of it, the rest of the 80% gets there, but it goes through a digestive process first, but it doesn't need to. If the stomach could take more than 20%, if the stomach could take 100% and pass it on to the bloodstream, it would do so. There's just a limitation of what the stomach can do, but you see, it requires no digestion. Now, alcohol is used to relieve stress, but what children do is they see their parents drink and they see their parents smoke and they say, oh, I just got to smoke to relax. I just got to drink to relax. And then they get to think that this is perfectly normal. This is what we do. We drink, we smoke. And then you relax. They consider it normal behavior. You have to realize that children learn what they live. Whatever they live, that's what they're learning. And to them, it's perfectly normal. Well, it shouldn't be, because children should not be addicted to drugs at a very young age. And we are losing kids all the time through drug use and through alcoholism. Now, I want to go into the 4 phases of alcoholism. There are 4 phases. The first phase is called the pre-alcoholic phase, and it's when alcohol is used to relieve stress and children see it, and there's a tolerance that develops. After a while, you use alcohol to relieve stress, it relieves the stress, and you come back to what your normal pre-drinking functioning was, and you think, oh, this is perfectly safe, I could just use it to relax, nothing happened to me, I'm all right. But then you see different changes occur, and after a while, a little bit is not enough, and you get so you tolerate it, and so therefore you want more and more and more. As you tolerate it more and more, you need more and more to get the same effects as you had before. You took alcohol to relax, and it worked. Okay, so after you do that for 2 or 3 months, you've got to take more than what you had before in order to continue to relax. And so therefore it gets to be a real problem. The tolerance develops and the drinking increases. So that the first stage is that pre-alcoholic stage where you are drinking and you're doing it for stress, and you're beginning to get a little bit tolerant of it, and you're beginning to need a little bit more. But it's still considered to be pre-alcoholic. The second stage is the early alcoholic phase, and this is where you start to have blackouts. Now, a blackout is a brief period of amnesia following drinking. In other words, you're drinking, you're talking, and you have a period of time where you can't remember what you said. I mean, I've seen people that do this. They'll talk to me about something, oh, we're having a party, or we're doing this, or we're doing that. And when I go back and talk to them about it again, they've got no memory of the fact they even told me. I told you that? I couldn't have told you that. I wouldn't have told you that. Well, you did, because how would I know if you didn't? You know, so you start to get amnesia, and it can be brief amnesia. It may not last too long, but that's the beginning of the early alcoholism. Now what happens is the alcohol is required. It's no longer pleasurable. What you need to remember is that once you start drinking or using drugs, a lot of the things that I say about drinking is also true of drugs. Once you start that, it is pleasurable to begin with, and then after that, when you start to tolerate and you need more and more to get the same effect, it's no longer pleasurable. You don't enjoy it, you don't like it, you'd like to cut back, but by this time, you've passed that line where you need it into, past the line from wanting it to needing it. When you pass that line, you're into alcoholism. Excuse me just a minute. Where you get, what happens here is still in the second phase. You'll have secret drinking, sneaking drinks, getting alcohol, making sure you always have it on hand, drinking fast in order to get it into your system because you're so anxious to have it in your system so that you won't get the side effects, the feelings of guilt that you're doing it, feelings of being defensive, and you deny it, and you use rationalization. So here it is, you're on a quest. You know, your family has asked you to go out to a picnic. I can't do it, I've got work to do. Well, what you're doing is you're staying away from things so you have a bottle by your side and you can be drinking. And that's the way it is. It starts to become secretive. You start to feel guilty, but now you've got to have it. And when you've got to have it, you will deny your friends, you will deny your family members, you'll stay away from them, you'll stay away from anything where you don't think you're going to be able to get your alcohol, because the alcohol or drugs is so important to you that you're willing to give up normal life in order to make sure that you have it. By this time, of course, you are thoroughly hooked on it. You are now an addict. And there's no real question about that. The secret drinking, the sneaking of drinks, the getting alcohol, oh, I've got to go downtown because I've got to buy something I forgot. You go downtown, what do? You have a drink, then you go home. You know, you're just shading it. You're acting in a shady way. You're hiding it. You don't want people to know how much you're drinking. You know how much you're drinking, but you don't want other people to know how much you're drinking, and so you hide it, and you make sure you have it. And if there's a drink available, you drink it fast to make sure it gets in your stomach. They're not going to sit there and savor it. So here it is. You are now an alcoholic. Now, there is a crucial phase of alcoholism. That's the third phase, and this is where you lose control and you become so physically dependent that you just can't live without it. You have binge drinking. In the binge drinking, that may last for hours, but it also may last for weeks. You may go to a hotel book a hotel for 2 weeks, let's say, oh, I'm going on vacation for 2 weeks. Well, what happens is you're sitting in that hotel room and you're drinking for 2 weeks. And this is where, and you just solid drinking. You're not going out on vacation. You're just finding a place where you can hide away and drink and no one's going to bother you. So this binge drinking includes sickness, the loss of consciousness because you can pass out, anger, aggression, and living in squalor. You at this point are willing to lose your friends, lose your family, lose your job, lose everything that's important to you for the sake of being able to drink and to be left alone while you're drinking. It is really a sad thing. Drinking becomes your total focus. You're willing to lose everything and every possession just so you can make sure that you're able to drink. At this point, you see, you have brain chemistry changes. Your brain chemistry changes are that you have to have the drink. You can't not have it. What started as a pleasurable little thing that just made you relax a little and you felt good has developed into a monster. And at this point, you don't even want the drink. You don't like the way it tastes. You don't want to have anything to do with it. But your brain demands it because the brain chemistry has changed so much that you can't get away from it because your brain is demanding it. And if you try to stay away from it, then you start getting the withdrawal symptoms, which I'll go into if I have a chance to. If not, we'll do it next time. So you lose everything. And then the fourth stage of alcoholism is the chronic stage, where you go through emotional and physical disintegration. You're intoxicated more than you're sober. You feel helpless, and you have a lot of self-pity, and you can become psychotic. I'm going to list off the psychotic symptoms, so at this last stage, and this is what they are: hallucinations, tremors, convulsions, severe agitation, panic, depression, and suicidal ideation. We'll get into that. The hallucinations is when you're seeing and hearing things that aren't there. Tremors is a shaking. Convulsions is like having seizures, epileptic seizures. Severe agitation, you're angry. You just can't manage life. You know, there's no calmness to you. Then you have panic attacks, you feel depressed, and you start thinking about suicide. These are all the symptoms of being in that fourth chronic stage of being an alcoholic. Now, I don't have much time left, so I'm going to close it here, and then I'm going to continue with this next time. So please join me then.